Medicaid serves low-income families, pregnant women, the elderly, and the disabled. They're at risk of losing adequate health care. Physical therapy, speech therapy, occupational therapy, PCAs and home health aides, assisted living, communication devices, mobility devices, and mental health care. Losing these supports would impact their ability to work and lead independent, healthy lives. I've worked as a para-educator and a job coach for 14 years. I teach vocational skills to students with disabilities, and I help them reach their potential as productive, tax-paying citizens. Most students that I serve will find jobs, go to college, or seek further vocational training. Schools bill Medicaid for expenses that are incurred by the services they're legally obligated to provide for special education through individual education plans, or IEPs. The Medicaid cuts don't cancel the legal obligations, so schools will have to find another way to pay for those services. Taxpayers would be forced to pay higher state taxes and property taxes to help pay for those services. And schools would be forced to trim their budget for staff, technology, elective courses, and extracurricular activities, so this would impact education for all of our students and be a financial hardship to our taxpayers. Schools are vital in the delivery of those services to students, and the students are at risk of losing these services when special education moves under Health and Human Services with Robert Kennedy at the head. He doesn't think we need these services in school. He says they're not academically required, and parents should get them outside of school, privately with their insurance or out of their pocket. Most parents that I know don't have the time and money for that. When families can't afford to care for their loved ones with disabilities at home, they can't hire PCAs, they can't afford services, that's a problem. The disabled people would be at risk of going back to state institutions. Brad Finstad and his fellow Republican politicians support Donald Trump's plan to cut $880 billion from Medicaid. These cuts won't lower our federal taxes. It's not about government efficiency. They're gutting our social programs to increase military spending and create tax cuts for the rich. And they're willing to hurt a lot of people to do it. Medicaid cuts would result in a lower quality of life, increased health risks, destroyed futures, and a loss of independence and dignity for vulnerable American citizens. It would separate families and eliminate millions of jobs. We've made so many steps forward. We should not be going back to the way it was. Don't these people deserve their constitutional right to life, liberty, and the pursuit of happiness? I believe that all people deserve to be treated with dignity and respect. If you agree, please call Brad Finstad and tell him that America can't afford to cut Medicaid.